Hantavirus pulmonary syndrome was identified for the first time in southwestern US when a group of healthy adults suddenly began to have problems with breathing, which resulted in respiratory failure. This happened in May 1993. After having their blood tested, it was shown that these people have contracted the hantavirus. Today's topic of discussion is the hantavirus. This virus is a rare but deadly viral infection, and it is spread by mice and rats. These rodents shed the virus in their urine, droppings, and saliva. Tiny droplets with the virus can enter the air, and people can come into contact with the disease by breathing in infested air or coming into contact with the rodent's urine or droppings. This virus cannot be spread from human to human. The deer mice, cotton rat, rice rat, and white-footed mice are the animals commonly known to spread the virus. This virus derives from the Bunyaviridae family. The hantavirus has virions that are enveloped spherical particles consisting of three segments of negative stranded RNA. This includes the lRNA, sRNA, and mRNA. Hantavirus pulmonary syndrome is also known as HPS. The mode of infection for HPS is through coming into contact with infected droplets, making this an airborne virus. Now we're going to talk about the symptoms that humans will experience from contacting the hantavirus. So to begin, early symptoms for HPS consist of fever, headaches, muscle aches, stomach problems, dizziness, and chills. Later symptoms of HPS include lung edema and shortness of breath. The later symptoms of HPS can also cause a period of severe respiratory distress. Due to inhalation of contaminated air with HPS, it will proceed into your lungs and to the cells lining the blood vessels. The virus will begin to attack the blood capillaries, causing them to leak. Thus, the lungs will be filled with fluid, resulting in difficulty breathing. Consequently, the blood pressure will drop and other internal organs will begin to fail. If the symptoms of HPS are recognized early enough, the patient can be taken to the intensive care unit. There, they will be treated with intubation, oxygen therapy, fluid replacement, and use of medications. Usually, patients can pull through the period of severe respiratory distress. According to the Center of Disease Control and Prevention, the map you see here depicts the effect HPS had on the United States in 2017. There was a total of 728 cases. The populations affected were 78% Caucasian, 18% American Indian, 1% African American, and 1% Asian. Currently, there is no specific treatment, cure, or vaccine for HPS. Patients who have contracted HPS are intended to fully recover and may experience long-term effects such as muscle weakness or fatigue. Studies on HPS has been stagnant, halting the production of an efficient vaccine. The low amount of adequate test models hindered further research on the diversity of the hantavirus and from developing a vaccination. As far as prevention goes, the best way to prevent HPS from occurring is to avoid contact with rodents in your home, workplace, or campsite. Seal up holes and gaps in your home or garage. Place traps in and around your home to decrease rodent infestation, and clean up any easy to get food. Hantavirus pulmonary syndrome is more common during the spring and summer times in rural areas of the country. The probability of infection is high for people who work, play, or live in spaces where rodents are actively living. Any form of contact with an infected rodent's waste will put anybody at risk of infection.